Hey everyone, welcome back to All About AI Tech, the channel where we explore the fascinating world of artificial intelligence and its impact on our lives. Today we're diving headfirst into a topic that's both incredibly exciting and a little bit unnerving: AI in healthcare. From revolutionary apps to ethical controversies, we're going to uncover the incredible ways AI is changing the medical landscape. So buckle up, hit that subscribe button, and let's get started. As you guys know, the world of AI is moving faster than ever, and nowhere is that more apparent than in healthcare. We're seeing headlines about AI diagnosing diseases with incredible accuracy, developing new drugs at lightning speed, and even performing surgeries with robotic precision. But it's not all sunshine and roses. There are also concerns about AI making mistakes, amplifying bias, and even threatening patient privacy. So, today, we'll unpack the good, the bad, and the downright scary when it comes to the AI revolution in medicine. Let's start with a closer look at an interesting new player in the mental health space, the Feeling Great app. This app, founded by renowned psychiatrist Dr. David Burns, takes his decades of experience in cognitive behavioral therapy, or CBT, and translates it into an AI-powered tool. The idea is to provide accessible and affordable mental health support to people who might not have access to traditional therapy. Now, I know what you're thinking. Can an app really replace a human therapist? That's a complex question, and we'll get into it in a bit. But there's no denying that Feeling Great is addressing a real need. Mental health services can be incredibly expensive and difficult to access, leaving millions of people struggling in silence. Feeling Great aims to bridge that gap by offering interactive courses, guided exercises, and even a chatbot that simulates therapeutic conversations. It's an ambitious goal, and only time will tell how effective it'll be in the long run. But the company just raised a whopping $8 million in funding, so they're clearly onto something. Okay, before we get too carried away with the potential of apps like Feeling Great, let's address the elephant in the room: the risks involved in handing over our healthcare to algorithms. One of the biggest concerns is the potential for AI to make mistakes. We've all seen those dystopian sci-fi movies where robots turn on humanity, and while we're not there yet, AI is still in its infancy. Even the most advanced AI systems can make errors, and in the context of healthcare, those errors can have life-altering consequences. Remember that story a while back about an AI that was supposed to detect skin cancer from images? It turned out that the AI wasn't actually analyzing moles. It was picking up on the presence of rulers in the medical photos. That's a pretty harmless example, but it highlights the importance of rigorous testing and validation before we unleash AI on real patients. Let's face it, guys, even human doctors aren't perfect. In fact, medical errors are a frighteningly common occurrence. According to a study published in the BMJ, medical errors are the third leading cause of death in the United States, accounting for over 250,000 deaths each year. That's like a jumbo jet crashing every single day. Now, I'm not saying that AI will magically solve this problem, but it does have the potential to reduce errors in certain areas. For example, AI can be incredibly effective at combing through vast amounts of data to identify drug interactions, flag potential allergic reactions, and alert doctors to subtle abnormalities in medical images that human eyes might miss. So, while AI isn't a silver bullet, it could become a powerful tool in our fight against medical errors. The key here, in my opinion, is not to replace doctors and nurses altogether, but to find ways for AI to augment their capabilities. Imagine a future where AI acts as an intelligent assistant, providing doctors with real-time insights, flagging potential issues, and suggesting treatment options based on the latest scientific research. This kind of human-AI collaboration could revolutionize healthcare, allowing doctors to focus on what they do best: building relationships with their patients, understanding their unique needs, and making complex medical decisions with empathy and compassion. Because let's not forget, there's more to healthcare than just crunching numbers and analyzing data. The human touch is irreplaceable. Now, let's talk about mobile health, or mHealth, because this is where things start to get really interesting. We're seeing an explosion of medical apps hitting the market, everything from symptom checkers and medication reminders to virtual therapy platforms and remote patient monitoring systems. These apps have the potential to empower patients, giving them more control over their healthcare and connecting them with medical professionals from the comfort of their own homes. Think about people living in rural areas with limited access to specialists, or individuals with chronic conditions who require frequent monitoring. Mobile health apps could be a game changer for them. Plus, let's not forget the convenience factor for all of us. Who wants to sit in a crowded waiting room when you can consult with your doctor through a video call? But here's the really mind-blowing part. This is just the tip of the iceberg when it comes to the future of healthcare. Technologies like artificial intelligence, machine learning, and augmented reality are rapidly converging, creating possibilities we could only dream of a few decades ago. Imagine a world where doctors can use AR glasses to overlay medical images directly onto a patient's body during surgery, or where AI-powered prosthetics can learn and adapt to a user's movements in real time. We're on the cusp of an incredible transformation in healthcare, and while there will undoubtedly be challenges along the way, the potential benefits are too great to ignore. But hold on a second, because with all this talk about technological advancements, it's easy to get swept up in the excitement and overlook the ethical considerations that are crucial to navigate. One of the biggest concerns with AI in healthcare is the potential for bias. Just like humans, AI systems can develop biases based on the data they're trained on. And if we're not careful, these biases can lead to disparities in healthcare, with certain groups receiving different levels of care or being misdiagnosed altogether. Remember that facial recognition software that was found to be less accurate at identifying people with darker skin tones? We can't let that happen in healthcare. It's our responsibility to ensure that AI systems are trained on diverse datasets that represent the entire population. And of course, we can't talk about AI in healthcare without addressing the elephant in the room: data privacy. Healthcare data is incredibly sensitive, and the thought of it falling into the wrong hands is downright scary. We need to be incredibly cautious about how we collect, store, and share this data, ensuring it's protected from cyberattacks and unauthorized access. Imagine if someone hacked into a hospital's database and held patient data hostage for ransom. That's a nightmare scenario we need to avoid at all costs. So, while we're busy developing all these amazing AI-powered healthcare solutions, we need to prioritize data security and transparency. Patients need to know how their data is being used and feel confident that it's being handled responsibly. And speaking of scary scenarios, did you hear about that app, Calmara, that claimed to diagnose STIs just from a picture of your, well, Yeah, you heard that right. The company claimed their AI could analyze an image and tell you if you had an STI. Now, aside from the obvious privacy concerns, there were serious doubts about the accuracy of this app. The FTC ultimately shut them down for making unsubstantiated claims and for using questionable data to train their AI model. This case is a stark reminder that not all AI solutions are created equal. Just because something is marketed as AI-powered doesn't mean it's effective, reliable, or even safe. We need to be critical consumers of this technology, demanding evidence, transparency, and accountability. So, where do we go from here? How do we harness the power of AI in healthcare while mitigating the risks and addressing the ethical concerns? Well, for starters, we need collaboration. We need doctors, scientists, ethicists, policymakers, and yes, even you and me, to come together and have open and honest conversations about the future we want to create. We need to develop clear guidelines and regulations for the development and deployment of AI in healthcare, ensuring it's used safely, ethically, and equitably. It's a complex challenge, but one we need to face head-on. Okay, folks, that's all the time we have for today, but this conversation is far from over. What are your thoughts on AI in healthcare? Are you excited about the possibilities, or are you feeling a little apprehensive? Let me know in the comments below. I'm genuinely interested in hearing your perspectives. And hey, while you're down there, hit that thumbs up button if you found this video informative, and subscribe for more deep dives into the world of AI. As always, thanks for watching All About AI Tech, where we explore the future, one algorithm at a time. Until next time, take care and stay curious.